Hi, my name is Amber Gentink and I'm going to talk to you today about direct instruction and how it can help special ed students in the classroom. In studies, it has been shown that direct instruction can help students with disabilities accelerate learning, increase their social skills, and show academic improvement. Research suggests that direct instruction can be used as a tool for at-risk students, disabled students, and students with autism to help accelerate their learning, increase social skills, and show marked academic improvement. I'm going to talk to you today about how direct instruction is an excellent tool to be used for accelerated learning for special education students, how direct instruction allows students who do not have the necessary skills to function in public, such as socialization and literacy, to be taught these skills more effectively. And I'm also going to talk to you about, while there's very little research on using direct instruction with language development, the few studies that have been done show that direct instruction can help those students. So first I'm going to talk about how direct instruction is an excellent tool to be used for accelerated learning for special education students. There was an implementation done of a direct instruction program. The writing skills of the students in the study, who both had learning disorders and emotional and behavioral disorders, showed an increase in skills over time. 6 out of the 10 of their participants made gains after 5 weeks of instruction. Also, the group showed significant gains in writing achievements as well. And that's from Veal, Runa, Hutchins, Jolett, Frederick, and Gamma in a 2010 study. In another study, it was found that some of the most dramatic increases in scores came in limited English proficient learners. Before the program, only 10% of the students scored at grade level. After a year of the program implementation, that number rose 36%. Direct instruction can also allow students who do not have the necessary skills to function in public, such as socialization and literacy, to be taught these skills more effectively. In a study aimed to help increase sight word knowledge, in a study done by Rue, Laughlin, Derby, and Johnson in 2011, the overall results indicated a large increase in isolated sight word knowledge for all 3 participants following the implementation of direct instruction flashcards. In addition, the passage reading data indicated a decreased likelihood that participants would inaccurately read their individual sight words in passage context. This research suggests that there is a possible link between direct instruction and students who are lacking in social and literacy skills. When direct instruction is used, students have a tendency to perform better as opposed to when any other methods are used. And this graph that I'm showing here is actually made from the scores from the study from Rue, Laughlin, Derby, and Johnson. In this study, the multiple effects of the direct instruction flashcards on sight word acquisition, passage reading, and errors for 3 middle school students with intellectual disabilities. They evaluated 3 different children who were using the direct instruction flashcard program. As you can see in the blue, the baseline scores were lower, and then after giving them the sets, they increased over time, significantly. Additionally, there have been other studies which also show a correlation with direct instruction and learning social and literacy skills that many people lack. Skills such as differentiating gender, specific behaviors, complementing social interactions, being kind, proper reactions for criticism, asking questions with the right manner in social situations. And that was a study done by Fox in 1984, as well as many others. And while there is very little research on using direct instruction with language development, the few studies that have been done show that direct instructions can help those students. In another implementation of Language for Learning, which included 16 preschool-aged children, including 4 of which that had developmental delays, and then they compared them to a control group of 20 preschoolers, including 4 of which had developmental delays, they discovered that the children with the developmental delays that was in the Language for Learning program had more growth in receptive and expressive languages and a greater reduction of behavior problems than the children of the control group. And in conclusion, direct instruction can be used as a tool for at-risk students, disabled students, and students with autism to help accelerate their learning and increase social skills and show marked academic improvement. Is there any questions?
Can these same techniques be used for non-special education students?
Yes, but their effectiveness cannot be overlooked for those children who are in special education programs. It's more effective with them than in the other students.
Ah. And why do these techniques work so well in these students?
They believe that it's because the research concludes that it's because of the structured environment that they are given, the students are given, and it helps them grow more because of that structured environment. And that's it. Thank you.